health analyst and a fellow of the Center for Democratic Development, Sarpong Asiedu, says despite efforts by the government, the positivity rates show that there is more work to be done. He spoke yesterday on Beyond the Lockdown show with Emefa Apao.
And so we can't expect that positivity rate that you talk about, that comparison that you talk about.
You see, I always talk using Ghana Health Service data. I can give you a number of examples. If you go onto the Ghana Health Service website, on the 30th of June, our positivity rate was 6.03%. Today, as I speak to you, it's almost 9%. So the data I talk about is not alien data. There's no way anyone can get alien data. If you go on the Ghana Health Service website and you read it, you would realize the statement I made about the 39 days. That, for example, if you look at the data that was released today, and you go and check, it clearly says the data is 582 cases released on the 23rd of July, but it comes from the 29th of June to 22nd of July. That is 3.5 weeks. If you go to yesterday's, the same data on the Ghana Health Service website tells you it comes to 35 days. The previous day, it comes to 39 days. So what I'm trying to say, and that is why I would have liked Dr. Wadi to have waited for me to finish, because I am quoting his data, not mine. And that is why I'm going back to the Ghana Health Service website. And more importantly, this is the same data that our World in Data and the WHO pick up. And for me, what I tend to do is, if I do run anything, I will go back and look at these data and compare it to comparative websites. What I'm trying to say is that as a service, they are making a lot of input. But if you look at the outcome parameters, based on their own information they're putting out, which I've read some out now, and what I see and what is appearing on our World in Data, it's appearing on Conima, it's appearing on Johns Hopkins, it's appearing on the University of Oxford, and all those come out with the same numbers I'm quoting. They don't quote any different numbers. It seems to me that they are making a lot of effort, but the effort they are making and the information they are putting out is not transcending into community collaboration. That is where I have a concern. It is not that they are not doing anything, but if you look at what they're doing and you look at the outcome numbers on these websites, you clearly realize that there's a bit more that we need to do. And if you listen to the president clearly, he also alludes to that fact in his statement he just released by saying that we've gotten to a point where the fight is more about the collaboration of the populace than it is about what the inputs are by official. And so if we don't make these disconnects and situate the data and we only try and gloss over them and not look at them with a painstaking eye, then we'll get to a point whereby we would fail to see when subtle changes are taking place, like I've just pointed out. And that is why I went off World Data International, and I'm currently reading from the Ghana Health Service website. So the data I am using and the denominator that Dr. Abuaje is asking for, I can provide. For example, when we had 694 new cases, the total test was 4,322. When we had 691, the total test was 3,793. For that, the positivity was 18.48%. For the previous one, it was 16.06. This is where the 7-day averages and the 14 and 28-day averages come from. And to land, I would want to say the WHO is clear. It says if your cumulative positivity is between 3 and 12%, it's okay. If your 4-week running average goes above the 12%, then you are not testing enough. That's not me saying it. These are WHO, press conferences that they've released, and I can share the documents with anyone. So I am not saying that they are not doing anything. I am looking at the outputs and outcomes And I'm comparing it with the amount of work they are putting in and saying,
okay,
we are not getting commensurate results.
Okay. So speaking of community collaboration and the collaborations that you've also alluded to, Dr. Aboagye has mentioned that they've tried reaching out to you, for instance, for some of the documents that you put out there, and it has not been forthcoming from you. Are you willing to collaborate?
Yes, let me correct that. That is not correct. I wouldn't want to divulge, but there were some people within his team who went unwell thanks to all these things. So we were working in a group, and when a number of people go unwell and you are looking for certain information, it's not forthcoming. That is the truth of the matter. Ordinarily, I wouldn't have spoken to it.
Okay.
But if he goes back and checks with his team, he would realize that some were taking unwell, and the information, questions we are posed to them, we hadn't gotten answers for. And these are the things. So sometimes I don't divulge this information, not because I don't have answers, but because I think that you go into the realm of patient confidentiality, where at certain points you have to put out information that's inappropriate.
Okay.
MFR Power there yesterday would be on the lockdown. So let's take a look at how we're doing in terms of our case count, shall we? Right, so there you have it. New cases, 532. Mind you, we have changed our case definition, and so we're not testing as much as we were. So 532 irrespective. Active cases, 3,307. 32,969. That's the number of cases we've recorded so far in all. And we're looking at some 29,494 people who have recovered, and unfortunately 168 people have died.